Hello, everyone. I am a specialist doctor in geriatric health. Throughout many years of practice, I have met and treated thousands of patients, most of whom are seniors over the age of 70. And there is one truth I always want to share. Not every medical test brings real benefits. Many tests may look harmless, even recommended for annual checkups, but in reality, they can cause serious harm to elderly health. We often believe that the more tests we take, the safer we are. I have seen so many parents and grandparents, after being advised by doctors or health providers, signing up for a full-body checkup package. They leave the hospital with stacks of test results, thinking they are better protected. But what most people don't know is that up to 37% of tests in seniors lead to unnecessary treatment, and in some cases cause complications worse than the original issue. Studies have shown that the majority of seniors over 70 are never warned about these risks when undergoing excessive testing. If I told you that some tests could actually increase the risk of surgery, harm your heart, or even raise your cancer risk, would you believe me? This is the truth, and I have personally witnessed many of my elderly patients fall into these situations. In today's session, I will explain 5 medical tests that seniors over 70 should be cautious about, tests that are not always necessary. I will also share real patient stories so you can see that not every test is good for you. More importantly, I will suggest safer alternatives to protect elderly health without unnecessary medical risks. Let us begin with the first one. Bone density scanning, or DEXA scan, is often used to detect osteoporosis. This test is quite common among seniors because everyone fears hip or spine fractures in old age. Indeed, fractures can lead to immobility, hospitalization, and higher mortality. That is why many seniors believe that regular bone scans will keep them safe. But here lies the problem. After the age of 70, almost every bone scan shows reduced bone density. This is actually a natural part of aging, just like gray hair or wrinkles. Such results often make seniors and families overly worried. And many doctors immediately prescribe osteoporosis medication, most commonly bisphosphonates. At first glance, this may seem reasonable, but in fact, these drugs carry many side effects. Patients can develop stomach ulcers, acid reflux, severe bone and joint pain, or even more serious conditions such as jaw necrosis. A long-term study of over 1,200 women above 70 showed that after 5 years, the risk of fracture reduction was less than 1%, while side effects were significantly higher. Take the case of Mrs. Rose, 76, a retired piano teacher. She was healthy, walking daily, and had never suffered fractures. During a routine checkup, she was advised to undergo a bone density scan. The results showed mild osteoporosis, and she was prescribed bisphosphonates. After 3 months, she developed stomach pain, loss of appetite, and jaw pain so severe that she could no longer play the piano. When she came to me, she was deeply worried and emotionally distressed. I stopped the medication, instead advising her to take vitamin D, eat a calcium-rich diet with vegetables and fish, and exercise with resistance bands. A year later, she returned healthier, happier, and still fracture-free. This shows that in seniors over 70, if they have never suffered a fracture or fall, routine bone density scans may not be necessary. The best prevention is a balanced diet, regular exercise, and proper vitamin intake. That is what keeps bones strong and prevents falls. Many elderly people panic when they start forgetting names, misplacing items, or feeling confused. They immediately fear Alzheimer's or dementia. As a result, many doctors prescribe a brain MRI. This is a modern test with detailed images, but in seniors over 70, the results often cause more harm than good. Most MRIs in the elderly simply show natural age-related brain changes, like mild shrinkage or small white spots in brain tissue. These are not dangerous, but when patients read the report, they often panic. This leads to more unnecessary tests, invasive procedures, or even risky surgeries. A 2021 study showed that up to 86% of brain MRIs in seniors aged 70 to 85 revealed abnormalities, but only 3% were linked to treatable disease. That means 97% of seniors ended up with false alarms, unnecessary stress, or even dangerous procedures like spinal taps or brain biopsies. One of my patients, Mr. George, 74, started misplacing his keys and sometimes forgot acquaintances' names. His family doctor sent him for an MRI, which showed white matter changes. He became terrified, convinced he was developing dementia. He stopped driving, avoided going out, and withdrew from social life. When he visited me, I performed a simple memory test. His results were completely normal for his age. After I explained that his MRI findings were just natural aging, he calmed down. We focused instead on improving his sleep, staying hydrated, and exercising his brain with reading and puzzles. Within months, his memory improved and his mood brightened. This case shows that mild forgetfulness in seniors does not always require MRI scans. Simple memory screening tests are often enough. MRI should only be used when there are serious symptoms like seizures, sudden personality changes, or rapid decline. Another common test prescribed for seniors over 70 is the cardiac stress test. This evaluates how the heart handles exertion, usually with treadmill exercise while recording ECG. Since heart disease is the leading cause of death in the elderly, this sounds logical. But here's the issue. Elderly hearts are already weaker. Forcing seniors to run or walk fast on a treadmill can trigger dangerous arrhythmias, sudden spikes in blood pressure, or even heart attacks during the test. A study in the U.S. on over 2,000 patients above 70 found that serious complications were 3 times higher compared to younger people. I remember Mr. Henry, 72. He occasionally felt mild chest tightness when climbing stairs. His doctor recommended a stress test. During the treadmill session, he collapsed with a heart attack. Fortunately, he survived with prompt treatment, but the incident traumatized him and his family. Stress tests in seniors often give inconclusive results because aging and other chronic conditions affect the readings. Safer alternatives include echocardiography or cardiac blood markers, which are more accurate and less risky. Colonoscopy is widely used for colorectal cancer screening. It is highly beneficial in middle age, but in seniors over 70 without symptoms, the risks outweigh the benefits. First, the preparation process requires drinking large volumes of cleansing solution, which can cause dehydration, electrolyte imbalance, low blood pressure, or acute kidney injury in seniors. Second, the procedure carries higher risks of bleeding or bowel perforation with age. One of my patients, Mrs. Alice, 78, was healthy with no digestive complaints. During a checkup, she was advised to do a routine colonoscopy. After drinking the PrEP solution, she became dehydrated, weak, and required hospitalization. Luckily, she recovered, but the experience left her anxious and sleepless for weeks. Guidelines from the American Gastroenterological Association recommend colonoscopy, mainly for those under 70, or seniors with family history or high-risk factors. For elderly patients with no symptoms such as rectal bleeding, persistent abdominal pain, or unexplained weight loss, colonoscopy can cause more harm than benefit. Safer options include non-invasive tests like fecal occult blood test or stool DNA testing. While not perfect, these methods reduce complication risks for seniors while still providing screening. Finally, let's discuss the rising trend of full-body CT scans. Many medical centers market this as a way to detect hidden diseases early, from lung nodules to liver or kidney lesions. Seniors over 70 are especially drawn to this promise of early cancer detection. But the reality is different. A full-body CT scan exposes the body to very high radiation. In seniors, the DNA repair system is already weaker, making radiation damage more harmful and potentially cancer-causing. Moreover, CT often detects small harmless abnormalities, leading to a cascade of follow-up biopsies and surgeries. I once met Mr. Richard, 75, who came with a thick folder of reports. He had paid privately for a full-body CT. The scan showed a small lung nodule. He immediately believed he had cancer, went through multiple tests, including a biopsy, only to find it was a benign age-related lesion. Yet for 6 months, he lived in constant fear and insomnia. Major medical associations do not recommend full-body CT scans in asymptomatic patients. Instead, seniors over 70 should focus on regular health checkups, basic blood tests for sugar, cholesterol, liver and kidney function, and blood pressure. These provide meaningful health insights without unnecessary risks. Through these stories and explanations, I want to leave you with one key message. For seniors over 70, good health care does not mean doing as many tests as possible. Overtesting often brings harm, from medication side effects to unnecessary surgeries. What truly helps seniors live longer, healthier lives is a simple formula. Eat a balanced diet, rich in vegetables, fish, and whole grains. Exercise regularly but gently, such as walking, stretching, or yoga for seniors. Sleep well, stay positive, maintain social connections, and above all, listen to your body and only seek medical testing when there are real symptoms, not because of commercial screening packages. I hope these insights help you and your loved ones understand elderly health better and avoid unnecessary medical risks. If you found this useful, please share it with your family and friends so more seniors can take care of their health the right way. And do not forget to leave your questions in the comments. I will answer them in future videos.